Hey there, and welcome. Today, we're diving into a health topic that affects a massive number of women, right here in Australia and all over the world. Uterine fibroids. We're going to break down exactly what they are, what they mean for your health, and what you can do about them, all based on solid expert medical info. Okay, so here's how we're going to tackle this. First, the basics. What even are fibroids? Then we'll get into the signs you should look for, how doctors figure it all out, and the big one, what they can mean for pregnancy and just your day-to-day quality of life. It's a really clear path to getting your head around it. So first things first, what are we actually talking about here? This is the question for so many women. Maybe you've just heard the term from your doctor and you're thinking, okay, what is actually going on inside my body? Okay, the very first thing to know, and this is super reassuring, is that fibroids are almost always benign. That means non-cancerous. So yes, they're technically tumors, but not in that scary way we often think. They're just growths of muscle tissue in the uterus, and they can show up anytime from your first period right through to menopause. And you know what? They are unbelievably common. Some studies show that a quarter to nearly a third of all women who go for gynecological care are found to have them. And that number includes women who have symptoms and women who had absolutely no idea they were there. It just goes to show how widespread this really is. So if they're that common, how would you even know if you have them? What are the kinds of signs your body might be trying to send you? Well, experts point to a few key things. The number one reason women end up seeking help is really heavy periods. Pain during your cycle is another huge one. But sometimes it's more subtle, like a weird feeling of fullness in your stomach or pressure on your bladder. Or it can even be a frustrating roadblock when you're trying to get pregnant. And when you think about it, it makes total sense. If a fibroid gets big enough, it can actually make the whole uterus larger. That can push on the bladder sitting in front of it, making you feel like you need to pee all the time, or press on the bowel behind it, which can cause things like constipation. And this is a really crucial point. This isn't just a small inconvenience. For some women, that combo of constant pain and really heavy disruptive bleeding can seriously impact their life, their ability to work, to go out, to just feel normal. Okay, so understanding the symptoms naturally leads us to the next big question. If you're thinking, this sounds familiar, how do you find out for sure and what are the options? The good news is the path to diagnosis is pretty straightforward. It usually starts with a simple physical exam where a doctor might be able to feel if the uterus is enlarged. But from there, imaging is what really gives us a clear picture of what's happening inside. And ultrasound is really the workhorse here. It's not just about getting a yes or no on whether you have fibroids. It's about gathering really critical intel. How many are there? How big are they? And, this is so important, where exactly are they? All that information is absolutely vital for figuring out the next steps. And here's another really reassuring point from the experts. Fibroids are 100% treatable. But, and this is a big but, if a fibroid is just found by chance, say during a routine scan, and it's not causing you any trouble at all, you might not need any treatment. It's not something that always needs to be fixed. All right, let's switch gears and talk about a topic that is, completely understandably, a massive concern for so many women: the whole connection between fibroids and pregnancy. Now, this is a really important distinction. You might assume that a bigger fibroid is always a bigger problem, right? But when it comes to fertility, that's not always the case. Where that fibroid is growing can actually be way more important than how big it is. And here's why. Think of a fibroid that's jutting into the uterine cavity. That's the space where a baby needs to implant and grow. It can literally get in the way, right? This can sometimes cause problems with getting pregnant or even lead to miscarriages. But a fibroid growing on the outside wall of the uterus, well, that might not cause any issues at all. So while tons of women with fibroids have perfectly healthy pregnancies, it's good to be aware of the potential risks, especially with really big ones or those in tricky spots. We're talking about things like a higher risk of miscarriage, going into labor early, or even issues with the baby's growth because the fibroid is taking up space. Sometimes they can also make delivery a bit more complicated, maybe increasing the chances of needing a C-section. Okay, for our last section, let's zoom out and look at the bigger picture. Beyond the medical stuff, how does this all fit into your overall health? Are there lifestyle things to think about? This is a question so many people have. Do the choices I make every day actually have an impact on whether I get fibroids or how much they grow? Well, the science gives us a pretty big clue, and it has to do with hormones.
We know that the hormone estrogen can act like fuel for fibroids. What's really interesting is that our ovaries aren't the only things that make estrogen. The body's fat cells can produce it too. So that creates a direct link between things like our body weight and the hormonal environments that can help fibroids grow.
So, what's the real takeaway here? It's not about finding some magical diet that's going to shrink fibroids. The advice from experts is that improving your diet and lifestyle is just a great idea for your overall health, period, whether you have fibroids or not. It's about creating the best possible environment for your entire body. All right, let's just quickly recap the most important things to remember. 1. Fibroids are super common and almost always non-cancerous. 2. They are absolutely treatable, but you don't always need treatment. 3. The symptoms can really affect your quality of life, so don't ignore them. And 4. When it comes to pregnancy, location, location, location is key. So we'll leave you with that question to think about. Because knowing your body and being armed with clear information like this, well, that's the most powerful first step you can take to be in control of your own health story. Thanks so much for joining us.